Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, reimbursement pressure necessitating innovative models. It's harder than ever to operate standalone SNFs amid inadequate government funding, and innovative business models deal with challenges, especially related to staffing. The biggest advice to nonprofits is, don't wait too long to explore alternatives and buyer options. Short of this, more closures and pared-down SNF operations with more vulnerable nonprofit nursing homes are leaning towards a model favoring a continuum of care. Reimbursement rates placed extra burden on nursing home staff, exacerbating leadership fatigue, turnover, and lender pressure. While the ability to attract and retain talent improved in the last 6 to 9 months, the complexity of skilled nursing, financial pressure, and poor reimbursement in a number of states has forced many nonprofits to seek affiliation or potentially close. Some add more private pay to make up for subpar government reimbursement. SNFs need innovation to survive current challenges as demographics show a significant decade ahead. About 7,200 SNFs closed between 2017 and 2022. Over 20 years ago, there were about 16,000 nursing homes, but nearly 600 nursing homes closed during the pandemic, while 48% of nonprofit facilities downsized or are in the process of downsizing. Find more info at skillednursingnews.com. Next up, regulators pushed for $25 per hour nursing home minimum wage. Labor advocates are pushing Minnesota's Nursing Home Workforce Standards Board to implement $25 minimum wage for all staff. Advocates are pushing for new retirement plans for workers, measures to increase staffing levels, and greater freedoms to join unions. Push from advocates coincides with a Workforce Board public forum to be held on February 29th. The event will invite comments on wages, working conditions, and challenges faced by LTC sector. It's open to current and former care workers, as well as employers and employer organizations. Seniors deserve quality care, and caregivers deserve wages reflecting the difficult demands of this profession. State clears 91% of nursing home survey backlog, and the rate is rising. Only 7 of Delaware's LTC facilities are not caught up on annual survey, but soon that number will be 5. More than half of the U.S. states fell significantly behind, due largely to pandemic staff shortages, but Delaware prevailed. 76 of 81 facilities, nearly 94%, will be caught up. Delayed surveys can be damaging to nursing homes that previously received poor results, since it can take longer for corrections to officially show up on record. State reduced the backlog of complaints against nursing homes by more than 40% in the last year. The state's Division of Healthcare Quality has struggled to fill surveyor vacancies and requires up to a year to train new surveyors. The U.S. Department of Health and Human Services Office of the Inspector General announced in January that it will be auditing the use of third-party surveyors, implying oversight is needed to ensure the quality of surveys. Delaware providers, however, are pleased with the conduct of the state's hired contractors, as they have alleviated the backlog caused by hiring challenges, and providers found them to be professional and well-prepared to move efficiently and thoroughly through the survey process. Further complications to the process are waiting down the road, though. Staffing metrics in the 5-star surveys freeze from April to July this year to be prepared for updated CMS metrics. Streamlining and supportive measures like using state contractors can be a great help to facilities dealing with complex survey process. Survey process is time-intensive, and policies and procedures allow for more efficiency for both parties and more time for resident care. Next, the Labor Department announces a $200 million grant for apprenticeships. The U.S. Department of Labor announced availability of almost $200 million in grants to support public and private partnerships that expand, diversify, and strengthen registered apprenticeships in nursing, mental health, hospitality, and other high-demand fields. Funding includes $95 million of grants through the second round of the Apprenticeship Building America grant program and $100 million in the second round of the State Apprenticeship Expansion Formula grants, providing America's workers with access to training and career prep, leading to good jobs with family-sustaining wages. The department said it will award 12 to 25 grants, ranging from $1 to $8 million. Info about the grants is available online, and application deadlines are between April 3rd and April 15th. Light-powered pacemaker uses optic fibers to control heart rhythms. A novel pacemaker tool could provide minimally invasive ways to regulate proper heart function. The pacemaker prototype, developed by scientists at the University of Chicago, was successful in trials and led one researcher to label the tool a new frontier for implanted tech. More than 2 million older adults in America live with pacemakers, and managing heart monitoring is a major issue for caregivers in community settings. The new pacemaker is made from lightweight, flexible membrane using fiber optic light to trigger precise electric impulses to different parts of the heart, maintaining healthy heart rhythms. Insertion is meant to be minimally invasive, and the tiny pacemaker is meant to dissolve within the body without causing harm. Although that's a temporary solution to heart disease, researchers said that they're exploring how to create designs for different lifespans. This light-activated tool eventually could be used for neurological disorders as well. Another dissolvable device focused on post-surgery heart monitoring is in development, along with flexible sensor patches for ECGs. And last but not least, CMS Post-Acute Care Quality Reporting Program's webinar. CMS is hosting a webinar to educate providers of current changes and help providers achieve a full annual payment update in the SNF QRP. The webinar will cover updates to the SNF QRP, MDS, NHSN submission and reporting requirements, available IKEYs and NHSN reports, reconsideration process for providers identified as non-compliant, and other helpful resources. This webinar will take place from 1 p.m. to 2:30 p.m. on March 26th, and that's EST. Find more information at CMS.gov. Thanks for joining News This Week in Nursing Homes. To get more Qsource news and info, visit Qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your nursing home QI needs, call the Q.